Hey Gerald, so this is the medical kit I've designed. I'm going to send you a list of the things in it, but I'm just going to quickly run through how it's set up and what my thoughts are on it. So there's a couple things that aren't in here. There's no blood pressure cuff. There's nothing that we can do to augment blood pressure. And so for the most part, as far as triaging patients, I figure we can go by the 80-60-40 rule. 80, 60, 40, and go from there. I don't see a huge value to a blood pressure cuff. It adds a lot of bulk, doesn't add a lot of value. Similarly, a stethoscope depends on your personal feelings. My feelings are that if I have somebody that has a pneumo, we're going to have uneven chest rise. I'm going to see symptoms. We're not going to be doing any kind of needle decoms in the field, so I don't see a huge value to having a stethoscope. I think that we can kind of assess based off clinical presentation and go from there. I figure that the less things that we're carrying, the less things get thrown around. If you're hugely attached to one, then obviously we can add one into the kit. And then I don't have a tourniquet in here. I figure that we can use paracord or we can use belts because speed, and most people put on a tourniquet wrong anyway, and then they cause more damage. Again, that's kind of up to you. I don't have a huge preference. Moving on from there, so this is my kit. So first up right here is wrapped in window insulation. This is Narcan. And so I keep this wrapped up just to have it be protected from the heat. Then when it comes time to use it, open it up, pull the Narcan out, stick it in the med kit. Next up is a splint. So I do not have a C-collar in here. This allows me to make an improvised C-collar before we go to before we bring in the bigger medical kits that carry an actual C-collar. I figure that as long as this is big enough to work for both a pediatric or an adult patient. It's not perfect, but it gives us the time that we need until we can get the right thing to them. Because it's just not realistic to me to be carrying an adult and pediatric C-collar on every single person every single time. But carrying a splint, it serves a lot of purposes. Alright, so for the actual kit. So I like the layout of this kit because it allows me to get to everything nicely. When I open this up, the first thing I see, I've got my hand sanitizer, I've got my gloves, and then I've got my meds. These are going to get us through like 95% of things. Then, going from there, I've got airway right here. So I have petroleum jelly for lubricant. I have CPR shield for CPR. I have this nice little piece of paper. This is NPA because I don't have an NPA in there, but we need one. I have the Narcan that I would put in there. I have glucose gel because people are going to forget about diabetics, and this is going to remind them to give it. And then finally, I have a horse wrap just because it's useful. It serves a lot of purposes. Seems like a good place to put it. Alright, moving to the center. So first things first, I did not pack my own chest seal. I have my own improvised version of one. So this is petroleum jelly and gauze. I know you like to carry your own chest seal. That'd be fine too. This is more multi-purpose, but it's also harder to apply. It's probably better to use an actual chest seal, but that's what I have at the moment. Next up, we have the wound the wound care. So I have antibiotic, and then I have cleaning agents, and then I have a blade. I packed a bidet. This allows me to use water, and if we bring a smart bottle or if we bring a collapsible bottle, that allows us to then clean out wounds on site. It's in standard with Knowles protocols, so it's not as good as sterile water, but it's not like we're going to be carrying around sterile water anyway. Then I have a pressure bandage for after we've got everything clean, and obviously some tape. Okay, moving over here. So the meds with ibuprofen, aspirin, Benadryl, Pepto-Bismol, loperamide, Tylenol, meclizine, and burn gel. So the only ones that might stand out as kind of weird, Pepto-Bismol, loperamide, and meclizine. My thoughts on those are that if we are losing fluids, that's going to make us worse. And if you look at somebody who's got heat exhaustion, nausea and diarrhea are pretty common, so if we're able to treat those, this is going to be better in terms of maintaining an eubulemic status. All right, over here, I have an ABD pad. Then I have gauze, 4x4s, 2x2s, more Vaseline dressings, as well as hemostatic dressings in case someone's on blood thinners or in case it's some kind of very deep wound that's just been an absolute bitch to stop. Then I have Band-Aids, multiple sizes, self-explanatory. And compressed gauze. If we have a fracture, we can combine it with the splint and the compressed wrap, or the horse wrap to make a nice splint, or just whatever wound or abrasions we can cover with this. This is an absolute bitch to pack on camera. Then moving on back here, I have a triangle bandage for fractures. I have steri strips. I have electrolyte and water purification tabs. I have 2 more things of glucose. A finger splint. Don't know if you really need it. I have poison oak wipes, kind of a luxury, but as long as there's space. A blister kit. And then I have a space blanket in here as well. These are put in here in the very back because all of these things are not airway or immediate bleed. I figure that these are things that we're going to be looking at as we're moving to stabilize that patient to move them. And so we've got time. Then back here, I have a trauma shears. Self-explanatory. I have a field guide for when people absolutely panic and lose their shit. I have skin prep for when bandages don't stick. And then I have the beginnings of a standardized report sheet so that we can guide people and just say, after you've stabilized, start filling this out. And it's going to guide them on what to do so that they don't sound like a total doofus. I then have a pen light and I have a pen. The way that I have this laid out is supposed to be in order of what will kill you. And what I mean by that is that when I walk up to somebody, and this is closed, so I walk up, hey, how you doing? Start clean, or as I'm doing my basic scene assessment, I'm going to clean my hands, get sterile. Not sterile, but clean my hands. Then I've got those meds. After that, I've got my airway, and I've got the reminder of glucose, and I've got my Narcan. So this is going to keep my airway open. This is going to cover most of my common causes of airway loss. After that, I have my blunt trauma and my gauze, and then after that, I have my things that aren't going to imminently kill you. And so the idea in this is that people aren't throwing shit everywhere, and that people are able to just kind of methodically move through in order of importance, the things that they need to protect. Basically, this is an ABC lineup. And then finally, paperwork at the very end, because they're going to be digging over here before they dig over here. So yeah, let me know your thoughts.